tests you're taking are doing more harm than good? What if those pricey checkup packages were quietly turning healthy people into lifelong patients? And what if a 90-year-old doctor with 60 years of experience could show you a smarter, safer path to aging well? I'm Dr. James Robert Wilson, an internist who spent decades leading internal medicine at one of the nation's top university hospitals. Now, at age 90, I remain sharp, energized, and healthy. Not because I chase after expensive health checkup packages, but because I've learned what truly matters through treating thousands of patients. In this video, I'll reveal a truth most hospitals won't tell you: the hidden risks of unnecessary medical tests that are often bundled into those fancy, full-body checkups. Alongside these excessive and costly procedures, I'll also point out the few crucial tests you absolutely should never skip. In just a few minutes, you'll gain clarity that could help you avoid needless worry, save thousands of dollars, and live a healthier, calmer life in your golden years. Ask yourself this: are your regular annual checkups silently creating more anxiety than answers? Is it possible that your fear of illness is being used to sell you unnecessary tests and prescriptions? Sadly, overdiagnosis has become an epidemic in modern medicine, an issue that often transforms healthy individuals into dependent patients overnight. Let me illustrate this with a true story. One of my longtime patients, Mrs. Linda Marie Thompson, age 67, was devoted to her health. She followed every recommendation, including full-body scans. During one of those sessions, an MRI revealed a tiny white matter change in her brain, a harmless result of normal aging. But the aftermath was devastating. The doctor's vague explanation filled her with fear. Linda became consumed with thoughts of an impending stroke or dementia. Her anxiety worsened, sleep vanished, and depression took hold. Ironically, her health declined not because of illness, but because of the unnecessary scan. It led to antidepressant prescriptions she never needed. In the end, the test did far more harm than good. As for me, at 90 years old, I only undergo a few minimal tests, specifically chosen based on decades of first-hand knowledge and clinical wisdom. No extras, no fear-based decisions. If you find this video helpful, please give it a thumbs up. It truly supports our mission to spread essential wisdom about aging well. And if you haven't already, hit the subscribe button and turn on notifications so you won't miss future insights. If you're already enjoying the video, drop a comment with the number 1. If not, comment with a 0, and tell me how I can make it better for you. Now, let's begin with what really matters: 3 critical medical tests you should never skip. But before we dive into the unnecessary ones, let's talk about what you do need to protect your health. Now let's highlight the 3 essential medical tests I always recommend, especially for anyone over the age of 50. These aren't just routine checkups. They've saved thousands of lives, including many of my own patients, and even myself. Number 1, the colonoscopy. Why is this test so critical? Because colon cancer doesn't always send warning signs until it's far advanced. The colon sits deep within the body, and many early symptoms go unnoticed. That's why a colonoscopy can be a silent hero. It detects and removes dangerous polyps long before they turn into cancer. According to the American Cancer Society's 2024 data, colorectal cancer ranks among the top 5 cancers for both men and women in the United States, with over 150,000 new cases diagnosed each year. But here's the good news: when caught early, the cure rate exceeds 90%. Colon polyps often take between 5 to 10 years to become cancerous. That gives us a powerful window to detect and remove them. Regular screenings can stop cancer before it starts. Let me share a real case. My patient, Mr. Thomas Edward Clark, was 71 years old and felt completely fine. No symptoms. But he trusted my advice and agreed to a colonoscopy. The test revealed a 1.5 centimeter polyp with early-stage cancer cells. Thankfully, the polyp was removed during the procedure. No surgery, no chemotherapy, no further treatment needed. Later, Thomas told me, "I thought I was healthy and didn't need any tests. Thank goodness I listened to you. I dodged a bullet." Today, he continues with routine colonoscopies every 3 years and remains in excellent health. I started my own colonoscopies at age 60. At 75, they found and removed a small polyp. Even doctors like me aren't immune. What I've observed over my 60 years in practice is this: patients who get regular colonoscopies age better and stay healthier than those who delay or avoid them. My recommendation: start screenings at age 50 or at 45 if you have a family history of colorectal cancer. If your results are normal, repeat every 10 years. If polyps are found, more frequent testing is needed. After age 80, it's best to discuss your options with your doctor, considering your overall health and life expectancy. Personally, I stopped at 90 because the risks started to outweigh the benefits. Benefits: colonoscopy has been shown to reduce death rates from colorectal cancer by 60 to 70%. And the risks? Minimal. The complication rate is under 0.5%. Also worth noting, in the US, there are national screening programs that offer the fecal occult blood test, FOBT, every 1 to 2 years for people over 50. If the result is positive, a follow-up colonoscopy is often covered by insurance or provided at a low cost, sometimes as little as $25. If you're still watching and finding these insights valuable, please comment the number 1 below to let me know you're with me. Your time means a lot. Next, let's talk about another test I always recommend: the upper endoscopy, and why it may be even more important than you think. Let's move on to the second essential test I strongly recommend: the upper endoscopy. Why is this procedure so important, especially as we age? Because stomach cancer often develops silently. In its early stages, it rarely causes symptoms. No pain, no warning signs. But if it's detected early, the 5-year survival rate is over 95%. Compare that to just 20–30% when caught in its later stages. That's a life-changing difference. The US currently sees about 26,000 new stomach cancer cases every year, according to the 2024 global cancer data. Much of this is linked to the high prevalence of H. pylori infections, affecting over half the population. On top of that, conditions like atrophic gastritis or intestinal metaplasia can silently progress toward cancer without any noticeable signs. Let me share a true story. Mrs. Emily Susan Davis, age 67, had no symptoms at all, but she joined a national cancer screening program and decided to undergo an upper endoscopy. What they found shocked her: early-stage stomach cancer. Fortunately, because it was caught so early, she only needed a minor endoscopic surgery. 10 years later, she's still healthy and active. Emily once told me, "I was terrified the procedure would be painful, but looking back, I'm so grateful I did it. If I had waited, I might not be here today." I personally started upper endoscopies at age 40. At 70, doctors found both atrophic gastritis and intestinal metaplasia, which prompted me to increase the frequency to once a year. It's important to understand that modern sedated endoscopy is far more comfortable than it used to be. It's not the unpleasant experience many people remember from the past. My recommendation: start upper endoscopy screenings at age 40. If you have a family history of stomach cancer, consider starting earlier, around 35. A normal schedule is every 2 years, but if precancerous lesions are discovered, increase that to annually. After age 80, consult your doctor to determine if continued testing makes sense based on your health. As for me, even at 90, I still do it, because stomach cancer risks remain high in certain populations. Benefits. Studies in the US have shown that regular upper endoscopies can reduce stomach cancer mortality by approximately 47%. And the risk of complications? Incredibly low, less than 0.01%. Plus, national screening programs often cover the cost or offer it affordably, typically between $50 and $250. Now let's talk about the third test that should be part of every senior's annual health strategy: the comprehensive blood panel. Why is it so essential? Because with just one low-cost test, you gain a broad overview of your vital health markers. A complete blood count, CBC, can detect infections or anemia. A lipid profile measures cholesterol and triglycerides, helping assess your heart disease risk. Blood sugar levels can signal diabetes or prediabetes. And liver and kidney function tests ensure your vital organs are working as they should. According to the CDC, diabetes and heart disease are responsible for over 30% of all U.S. deaths each year. But here's the good news. Early detection through routine blood work allows for timely lifestyle changes or treatments that can significantly reduce these risks. Let me tell you about Mr. William Henry Adams, 62 years old. His routine blood panel showed elevated cholesterol and signs of prediabetes. Thanks to that early warning, he made changes, cleaned up his diet, began exercising, and started taking medication. The result? He avoided a heart attack and stopped diabetes in its tracks. William told me, "I never imagined that something as simple as a blood test could prevent serious illness. It gave me a second chance." I've done annual blood panels since I turned 50. At 80, mine revealed elevated cholesterol, which I successfully controlled through diet and exercise. No medication needed. It's a simple step that continues to safeguard my health today. At 90, I'm still heart healthy, and I credit routine comprehensive blood panels for helping me stay ahead of potential problems. My recommendation: begin these tests at age 40, or earlier if you have risk factors like a family history of heart disease or diabetes. Make it an annual habit or follow your doctor's guidance based on your health profile. The benefits? Early detection of chronic conditions such as diabetes, which affects between 7 to 10% of adults over 50, and cardiovascular disease, can reduce the risk of complications by 20 to 30% when addressed early. And the cost? At public hospitals or clinics, these blood tests usually range from $50 to $100, making them an affordable and powerful tool for prevention. Now let's shift focus. In this next section, I'll cover 4 common medical tests that should be approached with caution, especially for healthy adults over 60. These tests are often marketed as routine, but in many cases they offer little to no real benefit, and can even lead to unnecessary worry, unneeded procedures, and wasted money. Let's start with the first, the routine echocardiogram. Why is it often unnecessary? An echocardiogram is a non-invasive test that visualizes your heart's structure and function. It's highly valuable when someone has symptoms such as chest pain, shortness of breath or fatigue, or a high risk of heart disease due to factors like smoking, high blood pressure, or diabetes. But in healthy seniors without symptoms, routine echocardiograms rarely reveal anything that changes treatment or improves outcomes. And the downsides? They're not trivial. First, the cost. Typically between $75 to $150, and not always covered by insurance when done as part of a screening package. Second, the emotional toll. Benign age-related findings, like mild valve sclerosis, can cause unnecessary panic. And third, low diagnostic value. According to the American Heart Association, echocardiograms in asymptomatic people reveal a clinically significant issue in less than 5% of cases, and those findings lead to a treatment change in under 1%. Let me share a real-life example. Mr. Michael David Lee, 67, opted into a premium checkup that included a routine echocardiogram. The results showed mild aortic valve sclerosis, a common and usually harmless age-related change. But the moment he saw the word sclerosis, panic set in. He lost sleep, avoided exercise, and became consumed by anxiety. It took several appointments and a great deal of reassurance to convince him that no treatment was needed. Reflecting later, he told me, "If I could go back, I wouldn't have done that test. It caused more stress than benefit." Now, at 80, Michael chooses not to repeat echocardiograms since he has no symptoms and a normal ECG. Instead, he focuses on managing his blood pressure, exercising regularly, and maintaining a healthy diet. My recommendation: only consider an echocardiogram if you experience clear symptoms, chest pain, unusual fatigue, shortness of breath, or if you've had abnormal ECG results or have significant heart disease risk factors. Otherwise, the potential harm from over-testing may outweigh any possible good. Let's now turn to another widely overused procedure: the routine brain MRI. Anxiety from unnecessary testing is often overlooked, but its impact can be profound. Brain MRIs, while useful in certain cases, can uncover minor findings that rarely pose a real threat, yet still cause emotional distress. Take, for example, silent brain infarcts. They're surprisingly common, found in up to 20% of individuals over 65, yet they rarely progress to full strokes. Still, hearing that something is abnormal on a brain scan can spark fear and worry. And let's not forget the discomfort factor. Lying still in a tight, noisy MRI machine for 30 to 60 minutes isn't pleasant. For some, it can even trigger claustrophobia or panic. Consider the experience of Mrs. Sarah Jane Miller, age 76. During a premium health checkup, she underwent a routine brain MRI. It detected a tiny brain aneurysm, something her doctors later assessed as low risk and not requiring treatment, just periodic monitoring. But the psychological toll was enormous. Convinced she had a ticking time bomb in her head, Sarah stopped traveling, gave up her morning walks, and spiraled into anxiety and depression. Her life changed not because of the condition, but because of the fear it triggered. Even I once had a brain MRI at 85, prompted by a short bout of dizziness. The results came back completely normal, yet I found the process uncomfortable and invasive, and I've decided I won't repeat it unless I develop serious symptoms. My recommendation? Only pursue a brain MRI if you're experiencing clear neurological symptoms like severe headaches, dizziness, paralysis, or changes in mental status. In the absence of such symptoms, managing your blood pressure, staying active, and living a healthy lifestyle are far more effective ways to protect your brain from stroke and cognitive decline. Let's now look at another overused test: the routine PET scan. PET scans work by using radioactive tracers to highlight abnormal cell activity. They can be very helpful in detecting certain cancers or neurodegenerative diseases. But for otherwise healthy older adults, they're rarely necessary, and the downsides can be significant. Let's talk cost first. PET scans are extremely expensive, ranging from $500 to $2,500, and often not covered by insurance unless there's a strong medical indication. Then there's the radiation risk, up to 100 times higher than a standard chest X-ray. And the kicker? They have a high false positive rate. According to studies, only 1 to 2% of findings turn out to be cancer. The vast majority are benign anomalies that lead to unnecessary biopsies, follow-up scans, and weeks, if not months, of anxiety. Mr. Richard Allen Carter, age 73, experienced this firsthand. A routine PET scan, part of a luxury checkup, detected slightly increased thyroid activity. Concerned, his doctor ordered a biopsy. The result? Benign. No cancer. But for a full month, Richard lived under the shadow of fear, convinced something serious was wrong. As for me, I've never had a PET scan. I've never had unexplained fevers, unusual weight loss, or other symptoms that would justify it. When PET scans were introduced at my hospital, I witnessed how many older patients were misled by false alarms, leading to expensive, unnecessary procedures and emotional strain. My recommendation: only undergo a PET scan if you have a confirmed cancer diagnosis, persistent unexplained fevers, or significant unexplained weight loss. In the absence of these red flags, the risks and costs far outweigh any potential benefit. Finally, let's discuss tumor marker blood tests like CA19-9, CA125, and PSA. These are often pushed in executive checkup packages as early cancer detection tools. But is that truly what they offer? Tumor marker tests like PSA, CA-125, and CA-19-9 may sound like valuable tools, especially when they're bundled into premium checkup packages. But if you're not showing any symptoms or don't have a high-risk profile, these tests can often do more harm than good. The problem lies in their low specificity and high false positive rates. According to data from the American Cancer Society, over 30% of PSA-positive results in men over 60 turn out to be due to benign prostate enlargement, not cancer. Now imagine the emotional toll. An abnormal result doesn't just sit quietly on paper. It leads to more tests, invasive procedures, and a cloud of fear. Biopsies, MRIs, repeated blood work, all based on something that might never have been an issue in the first place. These tests typically cost $100 to $250 per marker. And to make matters worse, they're not always covered by insurance. Take the experience of Mr. Stephen Paul Harris, age 68. He went in for a routine PSA test, expecting peace of mind. But a slightly elevated result led to a prostate biopsy. Though it turned out benign, the procedure was painful, and the weeks of worry left a lasting impact on his well-being. Stephen later reflected, "I regret doing that test. It caused more stress than it was worth." That's why I personally avoid routine tumor marker testing unless there's a specific reason, such as unexplained weight loss, persistent pain, or a strong family history of cancer. Instead, I rely on colonoscopies and upper endoscopies, which have proven track records in early cancer detection for those at risk. Now let's shift our focus to something far more powerful than tests: lifestyle. After over 6 decades in medicine, I've realized that maintaining good health in old age doesn't just depend on medical screenings. It depends on how you live each day. That's why I want to share some practical, research-backed lifestyle habits that have kept me thriving well into my 90s. First and foremost, exercise. I walk nearly 3 miles a day, and I encourage my patients to walk at least 30 minutes daily, 5 days a week. This simple habit can reduce your risk of heart disease and stroke by 20 to 30%. Movement is medicine. Second, eat well. I follow the Mediterranean diet, rich in vegetables, fruits, olive oil, nuts, and fish, with very little red meat or processed foods. This way of eating helps control cholesterol and blood pressure naturally. Third, sleep is sacred. Getting 7 to 8 hours of quality sleep per night reduces the risk of dementia and heart problems. Personally, I keep a routine: asleep by 10 o'clock p.m., up by 6 o'clock a.m. Fourth, manage stress intentionally. Whether it's through meditation, yoga, or simply spending time with others, nurturing your emotional health is just as vital as managing physical symptoms. I joined a book club myself. It's kept my mind sharp and my spirits high. And finally, avoid toxins. Quit smoking and limit alcohol. Smoking alone doubles to quadruples your risk of heart disease and cancer. I quit smoking at 40 and gave up alcohol soon after, and I've never looked back. Let me share one more inspiring story. Mrs. Patricia Ann Lewis, age 72, came to me with high blood pressure and elevated cholesterol. I advised her to start walking daily, shift her diet toward more vegetables, and reduce stress through mindful practices. 15 years later, she's never needed medication and continues to live actively and joyfully. Conclusion and call to action. Over 60 years of medical practice has taught me this. Your best defense isn't just in the tests you take, but in the life you choose to live. Smart testing, when necessary, combined with daily habits that nourish your body and soul, can give you not just longer years, but better ones. I hope this message brings value to your journey. Wishing you vibrant health, lasting happiness, and deep peace in the years ahead. And don't forget to subscribe to Healthy Aging Blueprint for more wisdom on living your best life. Personalized screenings like colonoscopy, upper endoscopy, and comprehensive blood panels remain 3 of the most powerful tools in early detection of cancer and chronic illnesses. These tests, when done at the right time, dramatically increase the chances of early treatment and successful outcomes. They aren't just medical procedures, they're lifelines that have saved countless individuals by catching silent conditions before symptoms arise. On the other hand, routine tests such as echocardiograms, brain MRIs, PET scans, and tumor marker screenings often provide little value for otherwise healthy older adults. In many cases, they create more stress than solutions, triggering unnecessary fear, prompting invasive follow-ups, and leading to significant financial strain. The risks and emotional toll are simply not worth it unless specific symptoms or risk factors exist. That's why it's so important to make thoughtful, informed decisions. Take time to talk with your doctor about what's truly necessary for your age, gender, and family history. Not all tests are created equal, and when it comes to aging well, quality trumps quantity. Even more vital than testing is how you live each day. Prioritize your lifestyle. Move your body regularly. Nourish yourself with balanced meals. Protect your mental well-being, and stay connected to your community. And if you haven't already, consider joining national cancer screening programs that offer low-cost, high-quality medical checks designed specifically for aging adults. Have you ever undergone a test that helped you, or one that turned out to be unnecessary? Share your experience in the comments. Your story could guide or comfort someone else navigating the same path. If you found value in this video, please like it and follow the Healthy Aging Blueprint channel. Turn on notifications so you never miss practical and inspiring tips for your well-being. And most importantly, share this video with a loved one. Your small act might just protect their health. Wishing you strength, serenity, and vibrant health in every chapter of your life. Stay well, stay happy, stay hopeful, and don't forget to subscribe to Healthy Aging Blueprint.